here. But at the board, it's much more simplified. At the board, the only things you get graded on for the facial is you're going to sanitize your hands first. You're going to drape your model, because you're going to do that on your live model. You're going to drape them just like you would for a shave. You know, put the hair cloth on, put the towel on diagonally, tuck it in, bring that corner up, tuck it in. You know, with the facial, I'll probably put a cloth towel in their back collar before I lay them down. So when you do step number 2, you don't get facial cream on their collar. So you put a towel in the back, the hair cloth on them, lay them down, and then put this towel on. And then basically the only points you get for the facial is sanitize your hands first, drape them. And you have to do it in that order. Sanitize, drape, and then you apply the facial cream. And once you get them draped and you apply the facial cream, I'm going to use this to prop our model up here. But basically, you're going to have a hair out of their face, and when you apply the facial cream, you're going to take your spatula, put just a little bit on your hands, wipe off the spatula, put in the sanitizer, make sure you put the lid on the jar. I like to spread it out on my hands, and then I apply it with smooth, stroking, rotary movements, and I just apply enough. You know, I apply it on the forehead, the nose, the upper lip, the chin, rotary movements, just to spread the facial cream out. And then once I get it spread out, you know, then I go right into the massage. And when you do the massage, you don't want to take your hands off your client. You know, I like to keep my fingertips right on the temples. And when you do the massage, you're always using the cushion tips of your fingers. And basically, you just have to go through the 7 steps. And we're using the effleurage, so that means you use very light pressure. You do it in a very slow, rhythmic manner. In other words, you don't do this, you know, this herky-jerky, you know, speed up, slow down thing. You know, we're not scratching them, we're doing a circular rotary movement. But basically, once you start, you don't take your hands off. And I use the cushion tips of my fingers. Step number 1, I just slide my hands down to the collarbone. That's this bone right here. And then with all my fingertips, I do a circular rotary movement. And I go up the sides of the neck, and I just use a couple fingers. I go behind the ears, in front of the ears, and then I just pause at the motor nerve point. That makes it relaxing. And that's basically the temple area. So step number 1 would look like this. Start at the collarbone, slow circular movements, applying pressure in the upward direction. We're trying to force the blood to the highest point. And then, you know, basically we have to do each one time. Step number 2, from the temples, I just slide my hands down to the base of the neck, and we do circular rotary movements along the back of the neck, and then I just apply a little pressure at the base of the skull, the occipital bone. That part sticks out right here. And that's number 2. I just slide my hands down, circular rotary movements, up the back of the neck, pausing at the occipital bone. And then from there, I just slide my hands to the chin. And my fingers, one of my fingers is above the jawline, the rest of them are below it. And I just use circular rotary movements in a slow rhythmic manner without a lot of pressure. This time we come up in front of the ears, and I just pause at the temples. And then step number 3, I slide my fingers down to the chin, along underneath the jawline, in front of the ears, and then pausing just momentarily at the temples. And then that's number 3. You know, again, you probably only do it very slow, rhythmic, but only do each one time. And then number 4, I slide my fingertips to the upper lip. I slide my fingertips along the upper lip to the corner of the mouth. I use circular rotary movements, and we're working in an upward direction, again, trying to force the blood to the highest point. And then I pause at the temples. You know, just along the upper lip to the corner of the mouth, I just slide them, and then circular rotary movements through the cheekbone area. Avoid poking them in the corner of the eyes, pausing at the temple. And you notice I never take my hands off. If you take your hands off and on, then it's not relaxing. So I leave my hands on once I start. Okay, and then the next step, we just slide our fingers to the tip of the nose, these two fingers go along the side of the nose. I meet up with my thumb. My fingers are below the eyebrow, my thumb's above, and it's just kind of a pinching, sliding motion along the eyebrows. So it would look like this. Slide our fingers along the bridge of the nose, along there, just slow sliding motion. Tip of the nose, slide those fingers along the bridge of the nose, meet up with my thumbs, and then just kind of a sliding, pinching motion along the eyebrows. And then number 6 is just circular rotary movements from the eyebrows to the hairline. I try to stay out of the hairline. And again, we're applying pressure on the upward swing. We're trying to force the blood to the highest point. Slide my fingers down, circular rotary movements, and then slide them down. I don't rotate down, but I'm always working the blood upwards, applying pressure on the upward swing, and I just slide them down. And then the last one, we just slide our hands over, and we do a zigzag motion from the eyebrows to the hairline. And we go this way, and then very slow, dramatically, we go back. And basically, when you do the facial at the board, it should be relaxing for the candidate, the person taking the test. You know, you've already done your shampoo, you've done your blow-dry styling, you've done your haircut, you've done your mock shave. So it's just a time for you to kind of relax and, you know, think about what you're getting into next, maybe a little bit, which is the mannequin head.
We do the cleansing cream first and then...
No. You know, you just, because you're doing a mock facial, you don't do all those extra steps. Just sanitize, drape them, apply the cream, do the massage, and then after the massage, you take a steam towel and you put it on and you wipe all the cream off. If you have to do it twice to get all the cream off, do it a second time. But usually you want to use the cream more sparingly. I would say about the size of a pea, you know, not a golf ball size blob, you know, and then when you get it on their face, it's completely white, you know. They look like a Ishu girl or something. You know, maybe you can see 2 eyes peeking out is all. You know, it's just supposed to be a light coating so that you can slide your fingers, you know. If you put a lot on by mistake, you get nervous and you think, oh God, I put way too much on. You can take a paper towel, just take a paper towel, which should have all your towels in a bag, all sealed up, either in your kit or in your back bar. You're not going to leave them setting out. But if you get too much on, you just take a paper towel like this, and I like to kind of crinkle it up to get it soft. And then before you put your steam towel on, you can wipe a lot of the excess off, and then throw that, you know, in that bag with all your dirty stuff. Your cloth and paper towels are in that bag. And then put your steam towel on, and when you put your steam towel on, lay it down here and try to avoid getting your steam towel on that white towel that's there. I try to set it down here, and then I lift this corner up, fold it, lift this corner up, and it folds itself. And then I fold it back out of the hairline. And then I like to wipe the face down, get all the facial cream off. I'll set the steam towel on their forehead, and then I get all this. I get behind the ears, I get the back of the neck. And then that towel goes in the bag right away. As soon as you take it off, put it in the bag. And at the board, every time you use the steam towel, you're going to discard it. And so you're going to need like 3 steam towels. When you do your shave, you apply the shaving cream. You know, I always like to keep this hand dry, put the shaving cream in this hand, and I apply it with circular rotary movements. The first time, I'm using the cushion tips of my fingers, and I'm working the shaving cream into the face to soften the beard. Then I take my steam towel, I put it on, I remove the lather, I discard that steam towel, and then the second time, I get lather in this hand, I keep this hand dry, and I just apply the shaving cream without working it in. I want to leave it thick. And then, you know, I dry my hands, get my razor out, and then I go through the steps of the shave. When I'm done, I get another clean steam towel, I remove the lather, and then I throw that towel away. So you need 2 steam towels for the shave, and then 1 at the end of the facial. And after you take the steam towel off at the end of the facial, remember to put your astringent on. There's little bottles of bay rum or different aftershaves in there. That would be your astringent or antiseptic, basically. After the facial.
Put antiseptic on after the facial? After
the facial. You don't do it after the shave, but after the facial. So again, the only points for the facial are sanitize your hands, drape them, Apply the facial cream with circular rotary movements, do the massage movements properly, and then you use the steam towel to remove the facial cream, you apply the astringent. So for the facial, that's basically, I mean, just that little bit of practice, and that's basically an easy 12 points. Those 6 things that I mentioned, sanitizing, draping, that's 6 points. And then throughout the facial service, they're going to be grading you on those sanitation things, and they do this for every service. For every service you do, it's like a new client. You know, the shampoo is a client, the blow-dry styling's another client, the haircut's another client. The only time it's the same client is when you do your relaxer and your color. You don't have to undrape and redrape, but every other time you do. And throughout every service, they're grading you to make sure you dispose of waste materials using your trash bag. So any paper towels, cloth towels, you have to throw them in there immediately. If you drop some paper, neck strips or something on the floor, you pick them up, you put them in there, whatever you have to dispose of. You have to ensure that the workstations remain sanitary by changing towels when soiled, cleaning spills, maintaining sanitized implements, materials throughout the service. That means you keep all your tools in the sanitizer, you keep everything else that's been pre-sanitized in this kit. Never put a dirty towel or anything in here, because if you do, from that point on, anything you use out of here is going to be considered dirty. So, and there used to be people that take their towels and set them on the floor, and then they put them in their kit with everything else. Boom, right off the bat, they probably failed the exam or something silly like that. Did a perfect haircut, but still they failed it because they did something that, you know, contaminated that whole kit. So just keep that in mind. That has to be kept clean throughout. Okay, you have to remove products from containers without contamination. Basically, that's using a sanitized spatula that you keep in your sanitizer. Every time you use it, you wipe it off, you put it back in your sanitizer, and you remove the facial cream from the jar, and you put the lid on the jar, you wipe off sanitizer and put it in there. You never put your dirty little finger in the jar, stick a comb in the jar, or anything like that. You know, there used to be people that would take the facial cream for some unknown reason. They take the facial cream, put a glob of it on the back bar, put the lid on the jar, move the spatula in there, and then use the facial cream from the back bar, which is dirty. You know, I mean, just foolish stuff like that. Okay, and then you have to replace any contaminated items. So towel falls on the floor, you discard it. Ensure all containers remain closed when not in use. That would be your kit and the facial cream. And then your kit has to remain closed. And you can take stuff out of your kit and put it in the cabinet. When you get there, you have time to set up, so you can sanitize that whole cabinet and put stuff in there, you know. But if you keep stuff in your kit, make sure you keep it closed, don't put anything dirty in there. You can have a separate bag for contaminated stuff, like your bowl after the hair relaxer and stuff like that. Okay, but that's basically the steps of the facial and, you know, the points you get for the board. There's actually 12 points for the facial, so there's a lot of easy points. I kind of look at a facial as a time to kind of relax, think about what you've done, and then think about what you have to do next, which is your mannequin head. And there's a lot of points on the mannequin head. You can't pass the exam without doing most of the mannequin head things properly. Okay, as far as this sheet goes, this actually has a lot of the information, and these are the steps of a facial that we give you out when you first start learning how to do facials and we go through the demonstration. And basically, at the top of it, it has the procedure. And again, this would be for just a facial on a client. This is where you're going to apply the cleansing cream and then 3 steam towels to make sure you don't have any dirt or debris on the face. You don't want to have a customer come in and has dust, sand that blew around and, you know, start rubbing that into their face. So whenever you do a facial on a client, the first cream you put on is cleansing cream. You spread it out the same way, and then you use 3 steam towels, and you're basically cleansing your face, getting any makeup, any debris off your face. And then you would apply a tissue cream, spread that out, and use that for the manipulations. And the difference is the cleansing cream is designed to cleanse the face. It's got a lot of mineral oil in it, but it's designed to remove stuff from the face. And then the 3 steam towels open the pores, and you wipe everything off, get it off. And then the tissue cream has a lot of lanolin in it. And the lanolin is real close to your own natural oil or sebum. So you use tissue cream for the manipulations, and you're basically trying to work that lanolin into the skin, help moisturize the skin, soften the skin. And there's other better products for facials and that. But basically, just the basic things would be the cleansing cream to clean the skin first, and then the tissue cream for the manipulations. And then when you're done, obviously you're using 3 steam towels to get all the tissue cream off. You can use a cold towel at the end to close the pores. That does the same thing as putting an astringent on. An astringent is something like witch hazel that causes the tissue to constrict, just like a cold towel. Where an antiseptic is something that kind of retards the growth of bacteria. And like a lot of these things are both an astringent like witch hazel because it closes the pores, but it also has a little alcohol in it and acts as an antiseptic. So you can put it on after trimming somebody's eyebrows or a neck shave or a facial shave or something like that to retard the growth of bacteria. You know, evade around or aftershave. Okay, just some theory of massage. Whenever you do a massage, each step should be performed from 3 to 5 times. So if a customer comes in, you're going to do step number 1 3 to 5 times, and then you move on and do step number 2. And if you have trouble remembering the steps, just remember that we started down here, and each step we're moving up higher on the face, and we finished at the highest point. And basically we're trying to work that blood to the highest point right here, which is the center of the forehead. That's why one of the last steps is this one. We work our way up the face with all the steps. Okay. You apply pressure on the upward swing. Again, we're applying pressure on the upward swing, trying to force the blood to the highest point. We perform the massage systematically, you know, step number 1, step number 2, working up the face, and a very slow, rhythmic manner without a lot of pressure. So we shouldn't see that skin moving all around. That's what we call friction, which is deep rubbing. Effleurage is very light pressure. So we don't want to use the deep rubbing type. We tend to use that more for a scalp massage, where you use firmer pressure because the scalp is harder, it's bonier. So to move that blood, you use firmer pressure when you do the scalp massage, you know, lighter pressure on the face. And then massage movements are performed from the insertion of the muscle towards the origin. Remember when we did anatomy, there's 2 ends of the muscle. One end is more movable, the other end is more fixed. And these movements are designed so you're working from the insertion of the muscle, which is the movable end, towards the origin, which the origin is a more fixed attachment. It's hooked to a bone or a major muscle, where the other end might be hooked to the skin or a smaller muscle. So we're working from the movable towards the origin, the more fixed. And that avoids damaging the muscle tissue. And then the other things we have to remember when we're doing there is pause briefly at the motor nerve points, like the temples, or the chin, or the occipital bone. Those are motor nerve points. When you pause on those nerves, that makes it relaxing. And then do not remove your hands once you start. You know, if you do have to take them off, you feather them off lightly and you put them back on. But that's the theory behind what you're trying to demonstrate when you do your facial at the board, all those little things. And then on here we have the steps that I went over that everybody should know. And then there's another sheet that kind of has a picture of the face with arrows pointing in the direction you go. But basically, if you do a facial, you can just lay that right down somewheres and, you know, just follow that sheet. You know, it's not like rocket science. You know, just a matter of practicing it. And then when you do your scalp massage at the board, remember you have to do that before you lay them down. After you get them draped and everything, you're going to do the scalp massage. You still use the cushion tips of your fingers, but use firmer pressure because the scalp is harder and you're trying to loosen up all those dead scales, underneath the hair. And we're still doing the same thing. Pressure on the upward swing, working in an upward direction, trying to force the blood to the highest point. And I'll do 3 or 4 strips like that, then I'll put my hand at the nape, the forehead, and I work, towards the crown. Yeah, you do the scalp massage, just 1 quick time. Just basically loosen up all that stuff, and increase circulation to the hair papilla, and does all those other things. Anytime you do massage, it's beneficial to the cells and the tissue and the hair because you're increasing circulation to the cells of the skin and the cells in the germinal matrix that grow hair. So the heat increases the blood flow, the massage increases the blood flow, and all those things help to stimulate the growth of the hair and healthy skin and all that type of stuff. Speeds up circulation, metabolism, getting rid of the waste products from the cells, all those good things. Okay. And then in the book it talks about different types of manipulations. The only one we use is the effleurage. And the effleurage is the one with very light pressure and a slow rhythmic band. They used to say it should be about the pace of your heartbeat. Just real slow without pressure. Friction would be the deep rubbing where you apply more pressure. And they used to do a rolling cream facial, which was cleansing and stimulating. And basically with rolling cream facial, you had this pink cream. You would apply a cleansing cream, cleanse the skin real good first, use steam towels to remove the cleansing cream, and then you would apply this pink cream. You put a little bit of it in your hand with a spatula, you mixed it with water, and you spread it out, and it would kind of dry like a thin mask. And then you would either use friction, which was a deep rubbing. Once it dried, you'd use the friction to remove it, or you would use a petrissage, which is like kneading. You grab the tissue, you kind of, with your fingers and thumb, you kind of pull it and twist it. And that's the kneading or petrissage type of manipulation. And because that was a mask and it dried, it would cleanse the skin, it would pull things out of the pores. And then because of the deep rubbing, the friction manipulations, or the petrissage, it was stimulating. So the rolling cream facial cleansed the skin and was stimulating. Cleansing because of the mask, stimulating because of the friction or petrissage types of manipulations. So whenever you see petrissage, think of kneading. Petrissage or kneading. And then the other one that they do is called the tapotement or percussion. And tapotement is just digital tapping, slapping, or hacking. And on the face, you would only use the digital tapping. Tapotement or percussion, like little drums, I guess. But tapotement, percussion, it could be the digital tapping, the slapping, or the hacking. And obviously, this is all you use on the face. You wouldn't do the other ones. So those are the different manipulations: effleurage, petrissage, deep rubbing or friction, percussion or tapotement, and then the other one is a vibrator, where you put, either a trembling motion in your hands, or you put that handheld vibrator on there, and you would use that massager. That handheld vibrator, basically, if you use that, you have to not use it on the upper lip. I mean, it just rattles on your teeth. It weakens those muscles. So you don't use the handheld vibrator on the upper lip. And to avoid damaging the tissue or overstimulating, you only use it for a few seconds. You don't work on one area too long. And you obviously want to be careful because your fingers are moving that you don't poke somebody in the eye, basically. So when you use that handheld vibrator, those are the things you look out for. Stay off the upper lip. Use it only for a few seconds. Okay, if you do a facial treatment where you're using lights, you have to be a little familiar with the lights. And the main lights you would use are ultraviolet lights or infrared lights. So remember, ultraviolet lights are just like the ones in your sanitizer. They're a short chemical ray, and they basically kill germs or retard the growth of bacteria. So if we're using a facial and using an ultraviolet light, we're basically using it to kill germs. So it'd be for facial or scalp treatments like dandruff, ringworm, things like that, where there's bacteria or something present. We're trying to kill germs. It's ultraviolet light. And when you use the ultraviolet light, you have to pre-clean the skin. You know, just like when you use the sanitizers, you have to mechanically clean your tools. You know, brush them off, wash your combs, brushes with hot water and soap, and then put them in there. So when you use the ultraviolet light, you cleanse the skin or they won't be effective. And when you use an ultraviolet light, you have to wear goggles to protect your eyes, and the client has to wear goggles to protect their eyes. So it'd be just like going into a tanning booth. They have to wear goggles. And then ultraviolet lights are a short ray, so they're usually like about 12 inches away. If they get too far, they're ineffective because they're a short ray. And just like going in the tanning booth, you'd start out for about 3 to 5 minutes and then gradually increase the time. So you didn't, you know, the ultraviolet rays didn't burn or damage the tissues in the dermis layer. Somebody real fair complected, probably lesser time. Okay, with the infrared lights, they basically are used for their soothing and relaxing effects. Infrared rays are a long heat ray. And with infrared rays, the lights have to be about 30 inches or so away because they're a long ray and they produce heat. And infrared rays are soothing and relaxing. And a lot of times we use infrared rays, like if we put on some type of a moisturizer and we want it to absorb into the skin, we use an infrared light to open up the pores so that those things can be absorbed into the skin better. But infrared rays are also soothing and relaxing, so they kind of soothe, relax muscles, nerves, things like that. So you use those for facial. With infrared rays, you don't have to wear goggles, but you usually use cotton pads. You get a little witch hazel or boric acid on there, you wring them out, and you place the cotton pads on the eyes. And then you expose them to the lights. But again, they're a long heat ray, so they have to be back about 30 inches. And then you have to pass your hand across there periodically to break up the rays. Basically like a heat lamp. Okay, so those are just some of the lights we use. We talked about the handheld massager. And the other thing they use are high frequency currents or electrodes. And the most common high frequency electrodes is Tesla. And basically high frequency appliances are those little glass things that they use for scalp and facial massage. And they hook up to a machine, and when you use them, there's a violet light that passes through there and a high rate of vibration. And they have one with a little round pad like this that we use for facial treatments. And then they have one that's kind of like a glass 4-prong grate they use for scalp treatments. But high frequency or Tesla current basically does a lot of things, and there's a high rate of vibration. Sometimes we'll even use this to kind of speed up the healing of tissue, high frequency treatments that the doctor does to speed up healing of injuries, things like that. But in the book it kind of tells you all the benefits of the different lights, all the benefits of the high frequency current. And then there's also a galvanic machine that they use. And a galvanic machine, one of the main things it does is it helps introduce water-soluble products into the skin. So it helps it, you know, absorb moisture, basically. So those are some of the appliances that are used. Okay. And then, as far as the book part goes,